Without further ado, let's begin today's session so that we have the stipulated time for each speaker. So first, I'd like to introduce Mr. Joseph Wong. He owns his own private practice at Orchard Physiotherapy Center at Orchard Building. He was a Colombo Plan scholar and graduated from Auckland, New Zealand in 1977. He has worked 8 years in the hospitals and 30 years in private practice. He has a special interest in sports injury management and treating musculoskeletal problems, especially the spine. He was appointed the physiotherapist for the Singapore soccer team in the 80s and the 90s. He has served the management committee in Singapore Squash Rackets Association and the Singapore Physiotherapy Association for many years. An avid fitness enthusiast, he's played competitive badminton in school, combined school level, and then squash for the last 20 years. He runs marathons and swims regularly, gives talks on sports and other related topics. So Joseph, the floor is yours now.
Hi, thanks, Venka. Very good morning to everyone.
Good morning.
Good morning.
Hi. It's indeed a really strange feeling to be giving a talk to a group of people through a Zoom meeting. The circuit breaker in Singapore has been in place since 7th April and almost 6 weeks now. This sudden restraining of physical activity and movement of people needs getting used to. Psychiatrists and psychologists report a spike in business for issues such as depression, marital disputes, home violence, or just the fact that the family is cooped up and facing each other like never before. I often share that the mind and the body are quite interrelated. When one is depressed or stressed, the body responds in ways which include a loss of appetite, reduced physical efficiency, and so on. Conversely, if one is elated, like having struck a lottery, whatever ills or physical pains there may be, these will be relegated into the background. I'm sure many of us must feel restless and agitated with the stay-home order, especially when previously physically active people cannot play their sport or do their regular swim or gym workout. Can you imagine how terrible a competitive athlete must feel being deprived of their regular training and competitions? How their fitness levels must have declined during this period? Well, I will this morning share from the physio's perspective how we can make the most of the situation in terms of keeping our bodies in shape. First of all, maybe an issue of weight gain. This happens when consumption of calories exceeds the burning up of these calories. So if you do not cut back on food intake when physical activity reduces, you will gain weight. As you know, the average daily requirement for an adult male is about 2,500 calories, and for an adult female, about 2,000 calories. And of course, more for a bigger person and those who do a lot of physical activity. Just to lose a pound or 0.4 kg of your weight, one must burn 3,500 calories. Just imagine. Can I have the first slide, please? Health-related fitness can be categorized into 4 items which I've listed. Cardiorespiratory fitness, how fit our heart and lungs are when we stress our bodies. Body fat, how much body fat we have. Muscular strength, and of course, joint flexibility. Okay, next slide, please. Performance-related fitness addresses stamina, which is muscular endurance, strength or muscular power, suppleness or our agility, and speed. These 4 S's constitute the performance-related fitness that we often talk about. Next slide, please. Why should we exercise regularly? Well, we get to relax better after physical activity. You sleep better, you're less irritable, and you're probably able to adapt better to emotional and mental stress. And it probably will improve your learning ability. Next. Exercise, sports, games, and other physical activities can be broadly divided into aerobic exercises, such as running, swimming, cycling, playing squash, skipping, and all that. These are exercises which employ large muscles of the body and uses up a lot of oxygen. Calisthenic exercises are things like push-ups, sit-ups, bending, stretching, usually used before the exercise and after the exercise, such as cooling down period. And then the next is relaxation exercises, which comprise things like yoga, Tai Chi, and all that. And the last is high resistance anaerobic exercises. These are exercises that really tax the heart and lungs. And anaerobic in that oxygen is in deficit, meaning like when you do heavy weights, you go into an oxygen debt, okay? And high intensive exercises like sprinting and all that. Okay, next. Let me suggest to you this fit formula exercise prescription. F, frequency, 3 to 5 times is a good guide, or alternate days. Intensity, this concept of maximum heart rate. Maximum heart rate is 220 minus your age. So if you are 30 years old, for example, your maximum heart rate should be 190. And how much do you exercise? You exercise up to 85% of that, which is about 160 beats per minute. Okay, so this is how you should push your heart. T, the first T is the type of activity. It should be a combination of aerobic and calisthenic exercises. And the last T is the duration. Okay, 15 to 60 minutes of continuous aerobic exercise during each session with some warm-up and cool down. So that would be a good recommendation for us. Okay, thank you. Next. I'm on. Okay. Exercise helps with your immune system, flushing out bacteria from your lungs and airways, increases your white blood cell circulation, raises body temperature, and all of which helps the body fight infection better. Exercise boosts our mental health, especially relevant during this anxious time. One of the easiest ways to get a good workout is to go out for a run or brisk walk. But if you wish to stay at home to exercise, there are many programs on YouTube that you can make use of. For example, the famous 7-minute workout. A typical workout at home should focus on basic activity that includes different parts of the body, such as planks, push-ups, squats, sit-ups, burpees. All these will build strength and get your heart rate up. So imagine if you do 5 different exercises and 1 minute of each, you would have done 5 minutes of exercise, and you do it 4 times round, you've got a 20-minute workout. Okay. At home, we can also use items like dumbbells, resistance bands, a skipping rope, which is my favorite. Skipping is an ideal exercise, very old-fashioned, but I think it's an excellent aerobic exercise. You can do things like yoga, you can dance to the tune of videos, you can do shadow boxing, you can do cleaning up the house, getting rid of things in the storeroom. gardening, and of course a good run or brisk walk. In all of these, what do you hope to achieve by exercising? Basically, we want to push up our heart rate, make heart pump harder. You want to increase respiration, so that you're breathing harder and harder and you're panting. You should perspire during and after the exercise. You should feel tired at the end of the session, so that activity becomes easier with subsequent workouts as the body builds up on endurance. And you experience what is called the training effect. The WHO recommendation, or World Health Organization, recommends 150 minutes of moderate physical activity every week, okay? Or half of that, 75 minutes if it's a very intense exercise. And then of course, don't forget the warm up and the cool down. Deep breathing exercises. I just want to mention a little bit about that, especially relevant with COVID-19 in mind. Deep breathing ventilates your lungs and improves lung capacity. Do it regularly during the day. How to do it? Basically, we would advise when you breathe in through your nose. Even before that, you should relax your neck and your shoulders and your upper chest. Breathe in through your nose. And then breathe out through your mouth through pursed lips. Your expiration should be much longer than your inspiration. I'll just do it one more time. Breathe in through your nose. Feel your lungs expand sideways. And then breathe out through your mouth.
Joseph, do you mind if
Yes.
I just interrupt you just for a bit?
Sure.
Sorry.
Yeah.
Just as an intermission, for those of you who have questions to ask Joseph, you can put it in the chat group, and Joseph will be more than willing to answer your questions as we move on. Thank you. Carry on, Joseph.
Yeah. And one of the most common complaints that we encounter in the clinic are patients who experience non-specific neck and back pain, mainly as a result of prolonged sitting in one position. Too many of us, sit behind our desk at work. It may be worse now with working from home, as the hours may drag on without one realizing it. So many of us do not have a proper workstation at home where the desk and chair are ergonomically designed. So one of the things I wish to comment on is our sitting posture, which I'll deal with just for a few minutes now. Most of us, when we sit, we tend to do this, especially when we're staring at the computer terminal. Even when we are driving, many of us do not rest the back of our heads against the back of the headrest in the car. We are often doing this. So the neck is protruded. What happens in this position is the head is quite heavy. And in order to hold the head up, the muscles around the neck are working. If your muscles are not working, your head will be like this, like when you doze off to sleep, yeah? But because you are sitting like this the whole day, your muscles are working, your muscles tense up, blood flow slows down, circulation slows down, waste products which are formed as a result of muscle contraction are not cleared away fast enough. And these waste products irritate your nerve endings, causing pain. And this pain is from a chemical source. Also, when your muscles are tense up like that, tension builds up and sensory nerves are being compressed, and you get pain as a result of a mechanical pressure on your nerves. And all this because you're sitting like this. Look at your neck now. It's in a kinked position, okay? Because you're narrowing the base of your neck. So your blood vessels and your nerves, they are being narrowed. And all this because you tend to slouch. See what happens when I sit up straight. Where is my head now? My head is fallen backwards. Center of gravity is back. The head is resting on the shoulders. So the muscles do not need to work to hold up the head. So your muscles are not tense. So this is an ideal position for you. Okay, so always remember, tuck in your chin when you're working at your computer. And when you're driving, make sure rest your head against the headrest of your car. A few exercises that we can do to relax muscles around the shoulder girdle and the neck. I'll just show you 4 simple ones, okay, which we can adopt whenever we feel some discomfort, whenever we feel lethargic and aching and all that. First is shoulder shrug. Try this for yourself if you want. Pull your shoulders up, try and touch your ears and hard as you can, and hold for about 5 seconds. Really hard. Come on. Squeeze, squeeze. 5 and rest. And then you do it again. Up, count for 5. 1, 2, 3, 4, 5, and then rest. Maybe repeat about five times. Do you feel a bit of warmth circulating in your neck now? Is your blood circulating? And following muscle contraction, there is relaxation. First is shoulder shrug. Second is shoulder roll. Just pull your shoulders up and pull backwards. Up and roll backwards. And pull your shoulder blades towards each other. Up and backwards. So this is the second exercise for the shoulder girdle. The first exercise for the neck, which is a general one, you try and hold the base of the neck, pull your neck forward, pull the base of your neck forward, and look up to the ceiling. Up all the way, all the way, all the way. Hold for a few seconds, come back, and then release your hand. And then you repeat again. Pull forward, look up to the ceiling, all the way back. Feel the muscle stretch, and then come back. Okay, you can repeat for about 5 repetitions. And then the last one, the second for the neck, is put your hand behind your head, and you, with your right hand, pull diagonally towards the right, and feel the left side of the neck stretch. That's right. Hold again for 5 seconds, and return to starting position, and then repeat again. And then come back. So these are just 4 simple exercises for your shoulder girdle and your neck when you feel discomfort coming on. And then a good thing to de-stress your back when you're seated is to get up and just do some simple extension exercises. Hands on the base of your butt, the base of your spine, and you just push your body forward and then lean back. And then come back. And again, push down, forward, and then come back. Okay, great. I think that's all I want to share this morning from my perspective. Now we can have a Q&A. Thanks, Victor.
No problem. Thank you very much, Joseph, for the suggestions of exercise and giving us some knowledge and tips on how our body functions. Seems like, are there any questions? I don't see any questions in the group chat unless I'm saying it wrong. Anybody can actually unmute yourself and ask a question if you want to. Okay, if not, Joseph, can I ask you a question? You know, sure. with a lot of people, once they reach 40 and above, they tend to, you know, their bones tend to be a lot more brittle and so on and so forth. So there's, you know, excessive amount of running or walking. Will that impact your bones in any way? You know, so just your opinion on the injuries that have come to you over the last 30 over years?
Okay. I think that when we are young, we can get away with murder. You know, we can eat McDonald's every day and we put on a bit of weight, nothing happens. Try and do that when we reach 30, 40, we are in trouble. So I always say, as we get older, exercise becomes even more important because our body functions on the skeletal system. If you don't stress it, you don't use it, you will lose it. Muscles are such that if you don't use it, you will degrade. You get weaker and weaker. And that's why when people get older, they fall easier because they are not fit and strong. So their balance, sense of balance, their endurance, their perception of depth and distance, they miss it and they fall and they lose their balance. So exercise definitely would strengthen them so that you avoid these accidents. So definitely as we get older, exercise is even more important than when you are younger.
Okay, I have a question that coming up. We won't do the poll for this round, but I have a question that has come out. Do you have any suggestions for certain type of chair for sitting down for long periods of time?
Okay. There are many chairs available in the market, and many of them claim to be ergonomically designed. But what I find is a lot of these expensive looking chairs, and they cost thousands of dollars, they are not really built with the Asian size in mind. Okay, so you go and shop for them, and a lot of us are not that tall. So some of these chairs are oversized for a lot of us Asians. So one has to look at it and decide which is suitable for you. And there are many in the market, so hard to say. But for us, for me, as far as I'm concerned, I think when we sit, we must maintain that curve in the low back. Okay, so in order to maintain a curve in the low back, you may want to consider using little lumbar rolls, lumbar supports, where you stuff it behind your low back, just here in the low base of the spine. Yeah. So when you sit, your back is in a way arched. Yeah. So it's fully supported. So because half the time when we sit, we tend to slouch. When you slouch, the low back muscles and ligaments are put on the stretch, and you maintain that for too long, you get up and you'll feel the strain. So I think any chair that you sit in, I think as long as you have a little lumbar support at the base of the spine to keep your back straight, I think to me that's very important. Never mind what kind of ergonomic chair.
Thank you, Joseph. What would be a good exercise to strengthen the core muscles, especially for one who is above 50?
Wow. Core strengthening, nowadays you can access the YouTube. There are many of them. Planks, forward planks, side planks. You can do things like Superman. Yeah, you can do bridging. Planking is a common activity. Core muscle strengthening, you can activate core muscles in many ways. So it depends on your level of fitness, your age, and all that, and also what you hope to achieve with your core muscles. For example, if you're a competitive athlete, if you're a golfer, for example, you want to have fairly strong core muscles. So to strengthen those core muscles will be maybe slightly different from, say, if you're a soccer player. Yeah. So it's a different kind of approach, but still working the same core muscles. Be difficult to demonstrate here in this, on this platform, but you can easily access the YouTube. They will show you how to work on core muscles.
Next question is, after intense exercise, there are pains in the joints which do not go away after 1 or 2 weeks. How common is inflammation of joints for those above 45 years of age?
Yeah, definitely. As one ages, for me, I remember when I hit 40 and when I hit 50, I could distinctly feel the difference, like following exercise. And aches and pains that follow exercise, we call them DOMS, or delayed onset of muscle soreness. These are very common, especially when you are not conditioned for that activity. And if they drag on for too long, then you probably have overdone it. Yeah, a bit of strain, aching for a day or 2, 3 days at most. If it drags on for a week or 2 weeks, it means you must have torn something. And then, of course, if it disables you enough, you should come and find somebody like us, and and then seek out medical advice. Yeah. So the key is really go incremental, go slow, especially if you're not fit. Especially now when you are, let's say you're confined by COVID-19, and you can't do, like for example me, I can't swim, so I don't expect to be super fit when I go back to swimming after 1 month. So you have to build up slowly to avoid onset of muscle aches and pains. Yeah.
How about those who already have knee injury? For example, they have not injury but knee pain. What exercise would be good for them? Or should they just avoid exercising?
A bit difficult to advise because every individual is different. So knee pain is very generic. So you have to look at the person's age, his activity, how fit he is. Look at the joint itself. You have to determine, the strength, the flexibility, so on and so forth. So it depends on the condition, because knee pain, it may be just a symptom of something that's underlying, which may be the cause of the pain. So one must examine and do a proper assessment before deciding on the next course of action. Yeah.
Okay. Next question is, please advise us on how you would tone up our muscles to prevent muscles atrophy with age.
Wow. Well, I think any kind of exercise is better than no exercise, if you ask me. So it depends on how comfortable you are doing certain activity. Like, for example, you ask somebody to go and swim, and this lady says, I hate swimming because it's, I have to wash my hair, I got to do this and that. So swimming is not appropriate for her. So you must do something that you like doing, okay? So like you like to run, indulge in running. And what was the question again? Sorry. How?
Advice on how you would tone up on your muscles.
Oh, okay. So I guess it's a progressive loading, how you tone up muscles. Each sporting activity would have different benefits. Like running would probably strengthen the lower limbs more than, say, the upper limbs. So this will be more specific. So if you want to do swim probably a little bit more of the upper limbs and the trunk, more than just the lower limbs. So it depends on which muscle group you want to work on. Yeah.
Next question is, are calcium supplements good for people who are above 50? Would you encourage that?
I think calcium supplementation is definitely a plus, especially in our kind of diet. In our Asian diet, we don't have probably enough calcium. A Western diet, dairy produce and all that, a lot of calcium, but we don't have enough calcium. So I think calcium supplements will make sense, especially when we know that we don't drink enough milk, we don't eat enough of calcium-rich foods, and the body needs calcium. And as we age, if there is not enough calcium, the body will leach the calcium from the bone. So that's why when people get old, they become osteoporotic, because the body needs the calcium. Where does it take its calcium from? From the bone. So calcium supplementation, definitely useful. But there are many supplements in the market. So one has to be discerning enough to fish out a good quality calcium tablet, because there are calcium tablets which once you ingest, it passes out the other end, not even dissolved, not absorbed. So you have to find a good brand that will dissolve and the body can make use of.
Joseph, I've got one last question which I'm going to ask. The rest I can't really answer. But this, since it comes from for someone who is above 70, I think it's good to take. What can be done for 70-year-old elderly who do household chores daily and have often back and arm, legs and muscles ache? What would you suggest? I mean, do less work?
I mean, if he wants to do housework as a form of exercise, fine. Yeah. I think that's good. But if he gets all these aches and pains following this activity, then he has to ask himself, why am I getting this? So let your body tell you what you can do, what you can't do. Maybe you are mopping, you're bending too much, and then you get backache after that. So you look into your activity and try and find out why the pain in the first place. And I think, like I said, any activity is better than no activity, especially at 70. Activity is definitely useful. Yeah, better than just sitting around and not doing anything.
Yeah. Okay, good. Just very quick answers to these questions, one-line answers so that we can move on. My knee has cracking sound when I stretch. It is over after exercising. Yeah, is that okay?
Okay. Crepitus or noise in the knee happens commonly. That means a lot of people, when you ask 10 people to squat and to rise on squatting, half of them would have some noise in the knees. But if the noise is not accompanied with pain, I think it's still okay.
Okay. Any particular shoes recommended for home exercise? Or
Shoes.
don't need to wear shoes here?
I don't think you need to, yeah. Unless you want to, like jump on the spot, then maybe some shoes to act as cushioning will be good.
Okay.
Yeah.
65 years old, resting heart rate 55, 10K steps a day. Do you think that's okay?
That's excellent.
Okay.
Excellent. Very good.
Excellent.
Yes.
Okay. Last question for a woman who to reduce arm fat. Which exercises needs to carry out?
Wow. Arm fat meaning you have to cut
Quick
back
one.
on your calories first of all.
Okay.
Yeah. Yeah. And then of course you need to tone up the back of your arm. So
Okay.
doing things like push-ups against the wall, dips,
Okay.
yeah, all these will help to tone up the muscle.
Thank you very much, Joseph. I mean, it's been a very enlightening session. You have given us a lot of tips in terms of how to keep ourselves healthy and our muscles in place and in check. So I'd like to first thank you. Kiki, who is helping me with this session, can you please unmute everybody? Just unmute everybody one time. Can all of us give Joseph a hand, please?
Good. Thank you.
Thank you.